Hello class, for the WHO Region Group presentation, me, Rupinder Kelsey, along with Benio and Daniel, will be discussing about 3 different countries from the region Europe.
Our region of interest is Europe. The European continent is made up of 44 separate countries and can be divided into the north, south, east, and west. The Arctic Ocean makes up the border to the north. The Mediterranean, Black, and Caspian Seas make up the border to the south, and the Atlantic Ocean makes up the border to the west, creating a peninsula. At just 3.9 million square miles of landmass, Europe is the second smallest continent in the world. Even so, it has a population of 747 million people. We will be focusing specifically on the countries of Italy, France, and Russia. Italy is a small country located in southern Europe. It is known for its distinctive boot shape, which causes it to be a peninsula. There are currently 60,361,109 people living in Italy, with just over half being female and just under half being male. The median age of those living in Italy is 47.3 years old, and most citizens identify themselves as Roman Catholics. Italy is considered a high-income country with an average of $26,588 per household and a gross domestic product valuing $2.6 trillion. Despite these averages, there continues to be a drastic difference between the amount of income in the north and south of Italy, as well as the top 10% of the country and the bottom 10%. Though Italy places a high value on education, it ranks as the second lowest in Europe in terms of university completion. A more grim fact about Italy is that it has a very vulnerable female population, especially in the south. Due mainly to financial reasons, women of the country are often seen as worthless and suffer much sexual abuse. The healthcare system of Italy utilizes universal health coverage. This means it is the government's responsibility to take care of the people and aid them in any ailments they may have. In order to afford this, taxes are imposed upon citizens and a pool of money is collected. From this pool, each region of the country is allocated an amount that the government feels is necessary for the health concerns of that specific region. This health care is intended to cover any and all types of care that may be needed and is expected to be of the best quality, though this is not always the case. Because choice of facility and treatment can sometimes be limited under universal care, some citizens opt to carry private insurance as well. While the private insurance cannot replace the universal, it is considered a supplemental aid to the universal health care and can provide better services. Typically, those with chronic illnesses take out private insurance. One of the main environmental concerns of Italy is air pollution. It has been found that majority of Italian locations have an air quality index rating much higher than what is considered safe by the World Health Organization. Constantly breathing in soiled air can lead to a multitude of health issues down the road. Some of the most likely ailments to arise are cancer, pneumonia, and decreased lung capacity and function. All of these can drastically decrease one's life expectancy as well. Another issue facing Italy is increasing temperature. Each year, the general temperature is increasing a couple degrees. In turn, this is creating disastrous rainstorms more frequently. With all of this water, flash flooding has become a big issue for Italians, as it can cause much displacement, damage, and death. The heavy rainfall is also causing ocean levels to rise rapidly. Being as though one of Italy's most famous cities, Venice, is located on the water, if this continues, it is predicted to be underwater in less than 100 years. Though Italy is known for its food, majority of famous dishes are not very healthy. Having a diet that is mainly composed of meat, pasta, and cheese, most Italians consume high amounts of fat daily. This is directly linked to the overwhelming rates of obesity in Italian people. Obesity in itself is a great issue, but it is compounded by the fact that it can cause many other health concerns, such as hypertension, diabetes, or heart disease, which is already a concern among Italians. In order to combat the growing obesity rates, Italian government has begun to provide better nutritional education and even implemented the Fruity Life program. This program attempts to increase the consumption of fruits and vegetables by making them more easily available. So far, the program has proven successful, with 81% of citizens stating that they have changed their buying and eating habits. The maternal mortality rate in Italy is quite good at just 2 deaths per 100,000 births. This is well below the European average of 8. As the graph shows, this rate was steadily decreasing at the start of the millennium, but seems to have plateaued now. While this rate is considered very good, efforts are still being made to lower the incidences of maternal death. Infant mortality is also very good in Italy. Currently, the rate stands at 2.7 infant deaths per 1,000 live births. Again, this is lower than the European average of 3.5 per 1,000. This rate has had a significant decrease over the last 60 years and continues to decline a bit more each year. As far as communicable diseases go, Italy is lucky enough to not have too much suffering. Majority of health concerns in Italy arise from non-communicable disease, but there are still some issues to be aware of. First, Italy has moderate rates of tuberculosis transmission at 7.1 cases per 100,000. While this may not seem like a lot compared to other nations around the globe, for a well-developed nation, this is considered high. Efforts to combat TB are proving effective as the rate is steadily dropping. Secondly, there is a fair number of individuals living with HIV or AIDS. Most recently, it was confirmed that 130,000 citizens of Italy had the disease, with most cases occurring in Lombardy and Lazio. Lastly, there are high rates of pulmonary disease and infection in Italy. As mentioned before, much of this is directly attributable to the high counts of air pollution. Since 2020, COVID-19 has also caused great damage, having almost 4.5 million cases in total.
So the country I chose was France. So France has been around for thousands of years, actually, and has only actually become a country in the late 1700s, and was fully established in 1946 after World War II. It's located in northwestern Europe. The current population is 65,439,355 people. 48% of that population is male, and the other 51.3% are female. Currently, the median age is 42.3 years, and the most common religion is Christianity, which is at 63% of the population. Afterwards, it's people who don't believe in any religion, and then other subsets like Muslim, Judaism, and then the average household income is in 2019 was 39 euros, and France is known for several things like food, art galleries, obviously Paris and the Eiffel Tower. They have a lot of structural architecture stuff too. That's very nice there. They also have some beaches close to the Mediterranean Sea. France's healthcare system is mainly universal healthcare. It's one of the many actually in Europe that has universal healthcare. The government's role states that healthcare in France is a national responsibility. It covers most costs for hospital, physician, and long-term care and prescription drugs. Patients are responsible for co-insurance, co-payments, and balanced bills. And 95% of the citizens have supplemental insurance, and this is considered private health coverage. This is considered voluntary health insurance, and it mainly is used for paying out-of-pocket costs and reduced co-payments. It's also used for other areas of healthcare like dental, hearing, and vision care. So France has quite a few environmental issues. It is ranked 15 in the world for natural disasters. It has things like floods, windstorms, heat waves, volcanoes, snowstorms, tropical storms, earthquakes, and droughts. Even more recently, France had a storm last year called Storm Alex, and it ended up killing 16 people and causing a lot of damage. Now, natural disasters, they are costly to repair, but one of the good things about France is that it is one of the leading nations in Europe for hazard risk management policies. In terms of environmental issues, some of the things that they try to face is climate change, air pollution, and waste management. It is currently ranked 10th in the world for waste management, and in terms of air pollution, they actually had a recent fine of 10 million euros because of how high their air pollution was, and they were fined from the UE. So a link between nutrition and health in France. Their main problem is their increasing obesity rates. Male obesity rates have increased from 22% from 15% in 2000. Female obesity rates increased 15 to 21% since then. Children also have increased from 5 to 9% since 2000. And just in terms of obesity, this is just in terms of obesity. They also have increasing overweight, which has gone up by 10 to 15% in the past 20 years as well. The way France is trying to implement healthier lifestyles is through food-based guidelines. So they also tried doing sugar-sweet taxes on beverages, and they have been trying to implement policies to eliminate trans fat from industrial-produced foods. France's maternal mortality rates have been quite low. The average maternal mortality rate in France is 8 per 100,000, which is the average in Europe. Averages decreased in 2011 and have stayed stagnant since. So if you look at this chart to the right, there's been quite a few dips, and it leveled out since 2011. And some of the good things that France does is that, France has, is that the population is very good with antenatal care, and is shown to have 98.9% are compliant with visits being with 4 or more visits. The other good thing is that their C-section rate is quite low compared to other countries. For this country, their pregnancy, the percent of people who are having C-sections are 20.8%. Infant mortality rates in France have changed quite dramatically over the past 40 years. So their current rate is 3.8 deaths per 1,000 births, and this is one of the lowest in the world. France rates is rated at top 8 in terms of the least amount of infant mortality, and it was initially 15.1 deaths per 1,000 births in 1970. So they've come a long way. The same thing is very similar with neonatal mortality rates. It's currently at 2.7 deaths per 1,000 births, and initially this was 9.1 deaths per 1,000 births in 1970. So France has 3 main communicable diseases at the moment. One is Hep A, the other is Hep B, and lastly, measles is the third one. In 2019, there was 1,375 cases of hepatitis A, and 3,400 cases in 2017. Hep B, there's been 8,500 to 9,000 acute cases and over 100,000 infections per year. Measles also has there's been a lot of cases of measles. In 2018, there was 2,500 cases. And the reason for this is that many French citizens do not believe vaccines are safe. And because of that, there's been upticks of or hotspots of diseases in France.
Russia is one of the 44 countries in Europe, which is also the world's largest country, occupying 1/10 of all the land on the earth. Russia extends across the Eastern Europe and Northern Asia, spanning 11 different time zones, and has shore to the three oceans including Atlantic, Pacific and Arctic Ocean, and it is bordered by 14 different countries. Russian Federation has the largest country area worldwide with a total area of about 17 million square kilometers. Despite its large area and being the largest country in the world, Russia has a relatively small population and ranks ninth by population with over 146 million people. Russia is a fairly ethnically diverse country and a multi-ethnic society. Majority of the population is ethnic Russian, but there are also more than 120 other large ethnic groups. Different ethnic groups have their own languages and religions, but the official language of the country is Russian and is almost spoken by everyone. The official Russian state religion is Christianity, with the Russian Orthodox Church being the country's dominant religious institution. In 2020, male to female ratio was 86.39 males per 100 females, and the ratio is growing at an average annual rate of 0.87%. Male population was estimated over 66 million, whereas female population was over 77 million. According to 2021 World Bank data, the gross domestic product was worth 1,483.50 billion US dollars, representing 1.31% of the world's economy. Education in Russia is compulsory for children between the ages 6 and 15, with primary and secondary school includes 11 years of study. The literacy rate in 2018 was 99.7%, which is an increase of 0.5% from year 2010. Russian healthcare system. Once, Russia used to have one of the world's finest healthcare systems, but the recent Bloomberg report ranked Russia healthcare last out of 55 developed countries based on the healthcare system efficacy. Out of 89 countries, Russia healthcare system ranked 58 in the 2019 Healthcare Index, with a very low score for the quality of infrastructure. Since 1996, healthcare in Russia is free to all the residents through the Federal Compulsory Medical Insurance Fund, also known as OMI or Obligatory Medical Insurance. Being the largest country in the world, Russia deals with a large number of different types of climate with a wide range of summer and winter temperatures. Temperatures can go extremely low to -76 to extremely high over 100 degrees Fahrenheit. Russia also experiences a large amount of heavy snowfalls, strong winds, forest fire, flash floods that brings the life to a standstill. The highest ever recorded temperature in Moscow, more than 38 degrees Celsius, was in July 2010 when much of the western Russia suffered a massive heat wave and huge fires. With changes in population demographics, deforestation and global warming, Russia's temperature is rising 2.5 times faster than the rest of the world. These climate changes cause huge destruction in the form of forest fires, flash floods, droughts, permafrost, and have damaged the equilibrium in the food chain, affecting agriculture and declining the GDP to 3%. Climate have a big impact on the food and diet in Russia. The typical Russian diet contains less fresh produce and more saturated fat and sodium than is recommended by the US Department of Agriculture and CDC. The traditional Russian diet is heavy on meat and dairy products. There are four major food groups in the Russian diets, including cabbage, bread, potatoes, and grease. Many dishes features red meat and animal fat. Dairy products such as sour cream, butter, sour milk, cottage cheese, yogurt has been essential ingredients in the Russian cooking for a long time. The leading cause of death in Russia since 2009 are cardiovascular disease and stroke, accounting for more than 57% of all the deaths. Similar to the whole world, Russia is struggling with the chronic problem of obesity and overweight. Major reasons include unhealthy diet, lack of physical activity, and extreme climate making food choice really hard. Data from the Russian Longitudinal Monitoring Survey shows that 36% of Russian adults are overweight, and obesity is steadily increasing at a rate of 0.4% per year. In 2020, the maternal mortality rate in Russia amounted to 11.2 deaths per 100,000 live births, which is much higher than the European average of 8 per 100,000 live births. Women in Russia are still considered as a vulnerable population and struggle with domestic violence, teen pregnancy, and abortion. Russia has seen a 3.53% decline in infant mortality rate from the year 2019, but it is still higher than the European average of 3.5. The current infant mortality rate in Russia in 2021 is at about 5.188 deaths per 1,000 live births. In accordance with WHO recommendations in 2012, Russia introduced a specialized medical care plan system for women and newborns during pregnancy, childbirth, and postpartum period. After this initiative, 99% of pregnant women utilized the antenatal care services, and more than 70% did not miss any antenatal visit during the pregnancy. According to 2020 UNICEF data, 100% of births they are registered in Russia, and 96% they are up to date with the immunizations. The results are promising, but still women and children they face multiple health and social issues. Over the past few decades, there were so many improvements and changes directly impacting the health and well-being in Russia. Many new policies were introduced in the healthcare system to improve the health outcomes, reduce the mortality and morbidity, focusing on all the levels of preventions including primary, secondary, and tertiary prevention. The most common communicable diseases prevalent in Russia are respiratory tract infections, acute intestinal infections, HIV/AIDS, and tuberculosis.
In the $1 billion aid package, we have to look at several factors for Europe. So social factors, there for our three countries, obesity rates, climate change, air pollution, those are big problems in all three of those countries and many of the other countries in Europe. Russia has is a bigger country, and it has other needs like maternal infant mortality rates that need to go down, and France has a high percentage of unvaccinated, which also needs to go down. And Italy has high rates of COVID deaths, which goes into other things like economy and lifestyle that is affecting their whole country. Economically, all three of the three countries pride themselves with excellent healthcare. Right now, around 20 countries in Europe have universal healthcare, which is very good. Also, renewable energy resources about 20% in the EU, and EU's goal is to raise it to 40% by 2030. Politically, most European countries except Russia and several other European countries are in the EU. The EU helps tackle various issues like health, climate change, economy, values and rights, migration, and education. One of the main concerns to bring to the World Health Organization is renewable energy. This is something that goes across the board in all the countries in Europe. There are high pollution rates that contribute to hundreds of thousands of deaths, premature deaths in Europe, and 7 million worldwide. Some of these diseases cause higher incidence of stroke, heart disease, COPD, lung cancer, and acute respiratory infections. high pollution also destroys ecosystems, and in Europe alone, 2.4 billion tons of carbon dioxide emission was released in 2020. This is a big decrease compared to 2019, but it's still a lot of pollution that is being emitted in the air. So for the management of this project, I would recommend Iceland and Germany because they have the best renewable energy resources. Iceland is a smaller country but has 100% renewable resources, which is great. Germany, it has a higher population, but it has one of the highest renewable energy resources at 65%. The money would be used to help increase the money that we would get from this $1 billion package would be used to help increase renewable energy resources within regions, especially countries with high pollution rates from emissions. So these countries would be like Poland, Slovakia, Czech Republic, and Hungary, which are the highest in Europe. And then expected outcomes, it will decrease in global warming, decrease in deaths related to pollution, and decrease in environmental damage, having an overall benefit across the region and hopefully the rest of the world as well.
And this is our handout. And these are our references. Thank you.